a little bit. Maybe you can roll your shoulders, right? So welcome, folks. We're just starting the recording now, and we've got a few people on, and thanks for the little emoji highs. We're going to be get going in just a few minutes. We're just going to give folks another probably 2 minutes or so to just get in, but make yourself comfortable. If you're able to move around, change positions, maybe you watch this recording in a different way than you normally watch your Zoom. So if you want to be up and walking around, great, if it's safe for you, or lying on your stomach or lying on your back, relaxing. Just listen to the audio. We're going to be covering some great information, and we'll also have a little Q&A at the end. So definitely keep your questions in mind, and I know we got a few questions in the sign up, so we'll try to address some of those as well. And we'll just get going in a little bit here. And I like a little bit of a shoulder roll, something simple. It doesn't have to be anything crazy, right? Maybe your neck stiff. Movement's very individual, so we feel move around the way it feels good for you. It's always a good place to start. So even under the table right now, I could be marching my legs, or if I'm sitting, I could be pumping my ankles. There's always something we can do, and we're going to get into a little bit of that today. So I'm glad to have a whole bunch of you here, and we'll give it just another 30 seconds, and then I think we'll jump in. Hope everyone slept well. You got a good meal. They're feeling good, and you're ready to learn something new today. Great. All right. So if you're just filtering in, we're just gonna get started in about 15 seconds. Thanks for being here. We appreciate your questions and your engagement. It makes a difference. All right. So, well, we'll get started here. So let me just make sure I'm presenting all right. Okay. So welcome to this next branch out session. I'm really excited to be here with you and sharing some information. My name is Dr. Jason Levine. I'm a doctor of physical therapy, and I'm working with Branch and Upside Health to share some of the information that I've found to work really well for my patients. And so that's what we'll be doing in this branch out session, and then future branch out sessions as well. I run a clinic based in New Jersey that focuses on preventative wellness, and I work a lot with chronic pain patients. I've got 2 young girls at home, and I've created some different programs, such as the Newish Parent Guide to Avoiding Unnecessary Pain, the Powerful Parent Club, Moving Beyond Ergonomics, and I'm passionate about creating realistic approaches to reducing pain and improving quality of life. And so this is some of the important information that I found to work really, really well for my patients and community. And so first off, it's great that you're here. One thing that we know about pain is that the more you understand about pain, the more you learn about pain, the less pain you have. And there's a ton of great research that's going on in the pain science world that really can benefit everyone, whether you've been in pain for just a little bit or not at all, and you want to avoid it in the future. Understanding pain and educating yourself on it is so important. And so just the fact that you're here is an awesome sign that you're going to reduce your pain levels. And just the fact that you're here and you're ready to learn, your risks are decreasing. So give yourself a pat on the back for just being here, for showing up, because the fact that you're here and that you're open to learning and experiencing some different ideas is a really, really great sign. All right, so thanks for coming. Today, just to overview the session, we'll be talking a little bit about how pain and movement are related, why movement's important and beneficial for our health, and then talking about ways to get started moving safely, even while you're in pain. And then we'll finish up with the Q&A session and cover some questions there. So many of you have seen John's presentations and Mike's presentations where they cover the different systems of responding. So I just wanted to throw this in here quickly because we know pain doesn't, it's not on an island, and physical symptoms can also be created by the emotional or behavioral or cognitive responses. And so everything works together. And so we know, if you think about how amputees, right, there's something called phantom limb pain where we even when there's not an area that can be physically damaged, there's still a large amount of pain that can be created by the brain. And so understanding that there's this connectedness is really, really critical to understanding your own pain and the triggers that can create some of your symptoms. And so we want to make sure that that's something that you're thinking about, right? And if you know that increases in certain levels of stress can cause some of your pain, right? It's important to understand that and know, because then if you know those areas to focus in on and think about, then you can change some of those triggers or modify activities or behaviors to reduce some of those painful triggers. And along with that, this is probably the most important slide of the whole presentation. Pain doesn't always mean damage. And we've been seeing more and more information that's coming out, especially as more imaging studies are being done than ever before, showing that if even two people with the same MRI, for instance, might have completely different symptoms. Someone who has no pain at all might have a worse MRI than someone who, who has no symptoms on their MRI and has tremendous pain, right? So there's a lot of variability in the sensations that you feel, and it's important to recognize that sometimes the physical experience doesn't necessarily mean you're going to have less pain, more pain, or less pain. A great example of this, there's an old case study story about a construction worker who steps on a nail on the construction site, and he sees the nail come through his boot and out the other side, and he's in immense pain. And they rush him off to the hospital. He is just in tremendous pain. And they get him set up in the ER. They hook him up on the IV. They're giving him some pain medication. They finally pull the boot off, and they find that the nail actually didn't pierce his foot at all. It went through the toes. And so that the perception of pain, of damage, it can be really strong, and it can trigger a lot of pain. And this works in different ways too, right? Where some people are going to be more or less sensitive to those perceptions of something that may be painful. So when we hear that maybe you get an image and it says something along the lines of degenerative disc disease or something that sounds scary, it can affect your pain symptoms when a lot of those changes are natural and normal progressions of how, as we get older and we use our bodies, that these things happen, and actually it doesn't necessarily correlate to pain because there are folks who have all sorts of different levels. So just keep that in mind as you're thinking about your specific symptoms. That doesn't necessarily mean that you will have pain, whether or not there's physical damage. So it's gonna vary. And so it's important to think about this also in this pain and fear avoidance model. And so when you think about how pain starts, right? Maybe there's a specific injury, maybe there wasn't, but you have the pain experience, right? That can either go in two different ways, where we go into this fear catastrophizing approach, which then can create some fear of movement and create some of this avoidance or hypervigilance, which then leads to disuse, disability, depression, and then that cycle can repeat. What I work on with a lot of my patients is reducing the fear, right? So getting away from that fear, so that way you can start doing healthy behaviors. And one of the things we know is really healthy for us is movement. And oftentimes, right, that fear of movement triggers that area to stay in that cycle, in that negative cycle. But what we want to do is say, okay, movement is really healthy for us. So what can we do to help reduce our fear of movement and then get into some of these positive habits and get out of this? And I thought about this a lot as a physical therapist. early on in my career, I thought, you know what, when I injure myself, and I've had plenty of injuries, why does it feel like I can get out of some of my symptoms faster? And before, a few years ago, I thought, oh, I know all the right things to do. And so I was really confident that because I know what to do, like those things, I'm helping my tissues heal faster. And what I've been learning and seeing in the research and thinking about for myself, included in this, is that a lot of what works for me is that reduction of fear. So just having that knowledge and understanding of what to do, or having some ideas as to what I can do, is actually reducing that fear of pain, which allows me to do some of the positive movements and exercises and ideas which can help get me into that positive cycle. And before all this, right, it can be easy to say, okay, I created some movement that caused pain, and that movement, right, I'm preparing myself for that movement to continue that pain cycle, right? So if I bend forward and I strain my back, and now I'm afraid of bending forward, and every time I have to bend forward for work or for movement or with exercise, or it happens when you're not planning to, we're prepared for that pain, and it can help us condition us into this idea of, okay, pain is going to keep happening. And what we know is that actually movement will be healthy for our tissues, and after a certain point, our tissues have healed. And so movement is really, really beneficial. And we've all heard this. We all know that exercise is good for us. And you see it in the news, you see it all over the place. But it's good for a lot of different reasons, but it can be tricky to incorporate when we've been in pain. And so we know, right, it's going to reduce chronic pain risks. It's going to reduce things like diabetes, improve your bones density and your muscular strength and your oxygenation of your body. And it can also help us to retrain our brains. So when our brains are on that high alert, right, and they're ready for pain, and you're in that cycle where you've been creating that fear around pain, we need to figure out, okay, how can we dial that pain scale down? And so when we've been in a lot of pain for a long time, right, our pain alarm can be really high. So maybe our tissue, because we know our tissues may or may not have any damage, and we can say, okay, what do we know is safe? What do we know that isn't safe? And how do we reduce some of the that pain alarm? And so what we want to do, right, is calm that pain alarm down, especially when we know we're doing something that's safe, that's not going to create damage. Because, right, so pain, you touch a hot stove, you want that signal that you got to move your hand off the stove. We don't want to, we don't want to keep having our hands on that stove and causing more tissue damage. So we want those positive pain signals. We want to learn from our pain when it's helpful, but at the same time, when pain becomes chronic, it becomes trickier to understand what's safe and what's not safe. So a lot of what we want to think about here with movement is, how do we figure out what's safe and where do we start so we can get the benefits of movement? We can get the good blood flow, the oxygen, the nutrition to our tissues. Okay, so it's important to think about, what can you learn from your pain? What can you understand from it, and how can you figure out what those triggers are? So the more you understand your pain and what triggers are, the more you can adjust your environment. You can create changes in your lifestyle. You can reduce your symptoms and create these lasting changes over time. So it's important to use our pain in a positive manner, right? To reframe how we look at pain and think about it positively, and say, pain is going to be helpful in terms of learning what can create symptoms, and we can use that to our advantage. So how do we get started? How do we think about reframing pain and our symptoms, and put it in a positive light, so we can get out of that fear cycle, the negative fear cycle, and get into the positive and reduce fear cycle? And so one thing to think about, right, is there's no one right way to exercise. If you're on social media, or you're watching the news and you're seeing like crazy Peloton classes or whatever major exercise classes you're seeing on YouTube, there's not just one right way to do it. There's never one solution. It's very individual. So keeping that in mind is important, and finding something that's right a good fit for you is super, super important. So first thing, every little bit counts. So doing a little bit is always better than doing nothing. So finding your starting point, and that could be something as simple as swinging your legs in a chair, or taking a short walk if it's safe, practicing your balance on a counter, or marching your legs. Or it could be, if you're strong and you want to lift 100 pounds and you're ready to do that, that could be where you start, and then you build your way up. But it doesn't necessarily need to be this traditional exercise class. So that's one thing. Be kind to yourself. So we all have different needs. So it don't put too much pressure on yourself when it comes to exercise. Think about what you can do to help yourself feel better, and set achievable goals. Check your expectations, and our bodies take time to adapt. So our tissues don't change that quickly. If you're training, in your bicep, you're doing a whole bunch of bicep curls, it'll take close to 6 weeks for those tissues to adapt. But you might notice that you're getting stronger in those arms. You notice that you're getting able to lift more. That could be for a lot of different reasons, but one of a positive stress on those tissues helps those cells to adapt and to build muscle tissue. But in those first few weeks, when it feels like you're doing more, you're actually creating this nervous system response where you have more control of the nerves of those muscles, and that increases the strength of what you're able to do. And then make it meaningful and fun and important to your unique needs. So making sure you have a reason and that motivates you, or a goal that keeps the exercise motivating. Because if you don't have that reason, it's really hard to keep that long-term progress and keep that consistency over time. And so when we think about this, there's a lot of excuses that make it really tough to move and to find that exercise. And one of the big ones, right? Sometimes it's not really fun to exercise. It's not something that we want to do, and you're not alone in that. As humans, we actually evolved to conserve energy. The idea of exercising for fun or for health is a relatively new concept. So don't beat yourself up if you feel like that is something that you don't like to do it, because you're not alone. And oftentimes what we want to do is think about how can we change our environment to create more movement, to create more exercise, so that way you're not having to think about it in this traditional sense that you got to go run off to the gym and do 30 minutes or a half hour of these workouts. But it could be starting small and easy, and working it into your life in a meaningful way. So are you too busy? When that's the case, right? How can you think about incorporating movement and exercise into your day in a way that's at your level? So, for instance, right, like if I know I want to strengthen my legs, I could do more squats at my chair. Every time I get up and down out of a chair, I could do 5 squats. Or if I want to work on my balance while I brush my teeth, I know I'm brushing my teeth for 2 minutes, in the morning and at night. That's a great time to work on my balance if it's safe at the counter, right? And so figuring out how you can map exercise and movement into your day throughout the day is a great way to fit more exercise in. And it doesn't necessarily have to be that traditional idea. It could be something that is enjoyable to you. It could be dancing, right? Like you're making dinner and you put your favorite music on and you dance around. That's a great exercise. I'm too tired, right? So we know that with lack of exercise, our energy levels can dip. So exercise at the right level can increase your energy levels, actually. So even though we're tired, getting that exercise in can be really, really helpful. Or maybe you don't feel like you're in shape, or things hurt when you exercise. And so that's I think for this group, thinking about how we can start is really, really helpful. So if, let's say, you have knee pain and moving your knees can be tough, there are lots of things you can do, right, with your upper body, for instance. So exercise with the arms, pumping your arms around, even like pretend jumping jacks with your hands. You can think about different ways to move around some of the areas that are irritated in the moment, or to modify, to scale back or forward. So maybe if doing a heel raise, right, going up onto your toes is tough for you, maybe you start by doing that heel raise while you're seated, so it's less weight, or using a counter to help support you in that movement. So small things like that are really important to think about. And then we want to make it stick. We want to make it get intentional about how we can fit that movement into the day. Maybe it's setting reminders in different locations. So when you wake up in the morning, maybe you have a post-it note by your bed that says, oh, these are 2 or 3 exercises that will be nice to do, that will help me start my morning in the right way. Or maybe it's by the coffee machine. Maybe it's in different places, at your workstation. So setting up your environment for success is really important. So having those tools nearby that makes it easy, where you don't have to think about the exercise, but it's just kind of there. Those things are great, and making it fun, right? So if something's not fun, it's less likely we're going to do it. So keeping things and making it fun, like dancing, right? If you're playing with your kids, that's an often underutilized or undervalued time. So thinking about that is really, really helpful. And then getting social, right? So one of the other areas we know is really great for our health is socialization. So finding ways to engage with friends when it's safe and appropriate is wonderful. And so even if it's you're virtually doing a workout at the same time, or maybe it's just going for a walk, or as the weather warms up, getting in the pool. So you with some friends, if you can find that time to socialize and exercise at the same time, that's great balance. And then start small, build up over time. So you can always modify and adapt as you go. So don't feel like you got to do so much all at once. Maybe you used to do a lot back in in high school and you're a major athlete. The goal is, our bodies change over time. So let's find a good starting point that feels safe and comfortable. And then we work our way up to increased activity over time. And then reward yourself, right? It could be something small, but maybe you're giving yourself a pat on the back. Maybe there's some other healthy treat, rather, that you want to you enjoy. Give yourself those mini rewards. It could be just a fist pump in the air, or high five with a family member or friend that makes you feel good. And so thinking kind of, where do you go from there? So it takes time to learn pain, and it also takes time to unlearn pain, to calm down some of those symptoms. And the more you can pair your movement with positive associations, reducing fear, the better, all right? The more your brain will be able to calm down some of those symptoms. So if you know that you have pain in certain positions or with certain movements, find another position to calm down some of those symptoms, okay? And that way, you can use that to help reduce the fear, right? So find that starting point, and then you can always modify to increase your activity level over time in a safe way. And then there's always some ups and downs in the recovery process. So whenever you're, especially with pain, it's normal to have some different flare-ups or some irritation that comes and goes. But that consistency over time, when you find a program that feels good for you, is really important and makes a big difference. So stay positive, learn from your pain, and keep optimizing. It really is helpful when you look at yourself like an experiment. So we think about, you create your hypothesis on what's going to help you feel better, what's going to work, and then keep testing that. Keep saying, okay, do I feel better when I do X, Y, and Z? Or it could be, right? It could be something as simple as ankle pumps in the air, or going for a few more walks. And great, how does that make you feel at the end of the day? If you feel better, awesome. What can you do to kind of keep ramping up that positive experience, reducing fear in some of the movements that bothered you in the past, and then keep going in that direction. So a few ideas here. I know it's complicated and it's a frustrating journey and it can be hard, but just by being here, thinking about some of these different ideas, it's a great start. So I appreciate you all being here, thinking about that, and taking some time out of your day to just kind of address some of these other areas, because what we know, right, movement is very, very helpful, bringing good blood, oxygen, nutrients throughout the body, to your tissues. There's the benefits are endless here. So finding ways to get started is just going to make a big difference in your quality of life in the long run. And with that, we can move to a quick Q&A. Thanks again for being here, and we appreciate your time, and happy to take some questions now.